Good evening, and thank you for joining us for Conversations Live Lyme Disease. I'm Patty Satalia. The Centers for Disease Control and Prevention reports that more than 30,000 Americans contract Lyme disease every year, and the number of infections is growing. Contrary to popular belief, ticks transmit disease 12 months of the year, even during winter. What can you do to prevent the tick-borne disease, and what are the recommended treatments should you get it? Tonight, our panel of experts will discuss the prevention, diagnosis, and treatment of Lyme disease. They'll also take your phone calls. Now, let's meet our guests. Steve Jacobs is an urban entomologist and senior extension associate at Penn State. Dr. Merrill Littman is a professor of medicine at the University of Pennsylvania School of Veterinary Medicine. And Dr. Barbara Ostrov is a rheumatologist and a professor of pediatrics and medicine at Penn State Hershey Children's Hospital and Penn State Hershey Medical Center. Thank you all so much for joining us.
Thanks for inviting.
Thanks. Tell us, Steve Jacobs, about the black-legged tick, more commonly known as the deer tick. How does it transmit Lyme disease?
That is a difficult answer to give, because where do you start in this story? If you just focus on that particular tick that already has the organism, the spirochetes, in its gut,
which is the bacteria.
The bacteria, right, Borrelia. It triggers these spirochetes as soon as the tick starts feeding. The blood hits the spirochetes. They somehow miraculously get through the gut wall of that tick into the tick's own blood, and from there swim to the salivary glands. It's there that they're injected with saliva when the tick's feeding on you.
One of the things that I wanted to sort out, if we could, is this idea of how long the tick needs to be attached before someone is at risk of getting Lyme disease. You can read 24 to 72 hours, 48 to, depending upon whose research you're reading, the number varies.
A lot of the work that's been done in that area was on rabbits, and I think you can say 24 hours, you're good. Once you start getting out from that, then your risk increases. Other work shows when you get out to about 60 hours, then the chance of removal of the tick is dropping to 70, maybe 60% effectiveness in terms of removing the tick at that time. You get much out about beyond 70 hours. If it has spirochetes, you're probably going to get them.
How about with dogs, Dr. Littman? How long must it be attached for a dog to be at risk of getting Lyme disease?
We usually say 2 to 4 days of tick attachment for the transmission. And I had read in the mouse, they clocked it exactly at 53 hours. And what has to happen, and you can help me here, is that the tick, as it's taking in the blood meal, will signal something in the blood to the spirochete, and the spirochete will down-regulate an outer surface protein that is a hook onto the midgut of the tick. It's called OSP-A, and it takes time for that to happen. And the OSP-C, which is a new outer surface protein, starts to get made. And so that's part of the reason that it takes time. But there are other tick-borne agents that can be transmitted faster, and that's why we would like to use a tick prevention that will stop tick attachment.
I want to talk about tick prevention in pets in just a moment. But this idea of knowing and how important this timing is a little concerning, because unlike a mosquito, that if it bites you, you feel it and you know it, we often don't know if we've been bitten by a tick.
Right. I mean, I talk about prevention as the main thing I talk about after treating Lyme disease, and the main thing is really the duration of tick attachment. And kids go out to play, or adults go to their hunting or whatever, they know they're tick-free when they go out, and they have to do tick checks. Just had a conversation yesterday with a kid with a very big, thick head of hair, who's just recovered from Lyme, and said this summer you're going to get buzz cut because it's the only way you're going to really be able to get those fingers in there when you come back from soccer and figure out that there's no tick in there. So
now ticks are attracted to carbon dioxide, so they sense when we're exhaling. That being said, where on the human body are ticks most likely to attach? Is it the scalp?
So it's generally speaking warm, dark, moist areas. So it tends to be groin, armpit, back of the neck, crawls up behind the ear. It's probably a little bit less oxygen in those places, I would guess, and maybe a little more carbon dioxide. I had not heard that before this discussion, but tends to be those warm, dark, moist areas.
Okay. Can you explain a little bit about this idea that they're attracted to carbon dioxide?
Yeah, that is important for ticks to find animals that are resting. Ticks don't move very much, very little. So if there's an animal lying down the forest floor and the tick's close, the tick will be attracted to that CO2. It doesn't come into play for us in that regard unless we're out there sleeping in the forest floor. But we can use...
Or even in our yards, because ticks can be found in our yard. I think you suggested that if you want to know if they're present in your landscape, take a white sheet and drag it across your yard and see if you pick any up.
Right. It's called dragging. Very effective. But I think from the standpoint of it having an impact on whether or not we get ticks, I think it's minimal.
Okay.
But it's a good way to trap ticks. You can put out CO2 traps and you can capture them that way.
Okay. We'll go to our first phone call. Alan is calling us from Saylorsburg. Go ahead, you're on the air.
Yeah, I was watching the opening of your program, and you stated that there was 30,000 cases, new cases, in the United States every year. It's more like 300,000 new cases every year.
We discussed this right before the program, and in fact, if you look at the CDC's website, it says 300,000, and a little bit later in that press release, it says 30,000 new cases reported a year. So we discussed that here and said it's more than 30,000, and even 300,000 could be, you said, Dr. Ostrov, a low estimate.
Yeah, I mean, I think it's very common.
Good point,
yeah.
but we wrestled with that because it's out there on the CDC's website both ways. Yeah. Anything to...
Yeah, it's the tip of the iceberg. I've been dealing with it since 1994. My whole family has Lyme disease, and it's utterly devastating financially for my whole family.
Now,
I've lost my life savings treating this disease, and that's all I have to say.
Okay, well, thank you for your call, and let's talk a little bit about treatment of Lyme disease in humans. It sounds like he and his whole family this has been an ongoing struggle.
Yeah, so, I mean, the usual treatment is between 1 and 3 total months of antibiotic therapy, and a lot of scientific studies have looked at whether or not prolonged antibiotic therapy changes the course for that tiny percent of people that have chronic symptoms, and there's not data that suggests that that makes a difference in the long term. So,
and could it be harmful for someone who's been on antibiotics for over a year, for example?
So you could develop antibiotic resistance. Ceftriaxone is given intravenously, and if someone has prolonged ceftriaxone therapy, that requires an IV to be implanted, and then you have the risk of clotting of the IV or blood infections through the IV. And there's actually some research that shows that the risk is about 5% of having complications of having the IV, just the physical IV in place. So between antibiotic resistance, which we hear about all the time, plus the fact that there's not scientific data that shows that more than 3 months of prolonged antibiotic therapy actually changes the course.
So you're obviously not recommending it. So what is the alternative for someone like our caller just a moment ago who is suffering long term?
Yeah, so depends what the symptoms are. So if someone as a rheumatologist, most of the patients I see have arthritis-related issues, and the research shows that once they get past 3 months of antibiotic therapy, they still have active arthritis issues. You approach it like you would an adult with rheumatoid arthritis or a child with juvenile idiopathic arthritis, and give them whatever therapies they need to focus on their symptoms.
Okay. We'll go to Lori, who's calling us from Belleville. Go ahead, please, Lori.
Hi, I was diagnosed with anaplasmosis and monoplasmosis, and I did not test positive for Lyme, but I tested positive for a tick-borne disease. What is the difference between that? Do you have to have Lyme first or not? I don't understand that. And I'm on 2 antibiotics, and I'm going on 6 months and have some neurological issues. And I would say I feel better when I'm on antibiotics, and I do think symptoms are getting better. But I was just wondering that what's the difference between the Lyme and the tick-borne disease of anaplasmosis?
It's not unusual for co-infection. The tick that carries Lyme disease also carries this anaplasmosis.
I mean, there's multiple different tick-borne illnesses, and one evil little tick can have, you know, multiple bacteria in it, and so you don't. It doesn't have to have Lyme. It doesn't have to have ehrlichiosis or Ehrlichia or Babesia. It could have anaplasma. So, you know, it doesn't.
Is the treatment the same?
There's different antibiotics for the different organisms, and I actually don't know much about anaplasma at all. We were talking about that before.
We would use doxycycline in a dog. But so many dogs are positive for anaplasmosis and Lyme that don't show any signs of illness at all. So we don't necessarily treat just because they're positive for antibodies to those diseases.
All right. We've got another call. We hope that helps, Lori. Thank you for your call. We've got Carmen from Northeast Pennsylvania on the line. Go ahead, please.
Hello.
Hi.
Yes, I have a simple question for you. I'm a regular blood donor, and they always the pamphlet they give you mentions the virus from the West Nile virus. But I'm in the woods an awful lot, and it sounds like sometimes this Lyme disease can go undetected. And am I at risk at giving possibly donating blood that could be infected, and I didn't develop symptoms yet?
The impact on the blood
right. So
supply?
I mean, I've had that question asked before, and I've not seen any reported research that suggests that you're at risk or that your donor, the people you're donating to, are at risk.
Well, you're at no risk donating the blood.
Correct, right, but that the person receiving your blood would be at risk. So I don't think the bacteria is not hanging out in your bloodstream for prolonged periods of time that would put someone at risk by getting your blood.
I just wanted to talk with Steve Jacobs for a moment. I read that it's not unusual for a deer to have 1,000 ticks on its body at one time. So, of course, it's important that hunters, or anyone in spending any amount of time in the woods, take precautions. What advice would you give to someone who is spending time in the woods or in areas that are known to be infested with ticks?
Well, I'd like to run back to our first caller because I heard something there I wanted to say.
Okay.
If his whole family has Lyme disease, then they're probably living in an area that has lots of ticks. And there may be a situation here where you're getting reinfection from year to year. Mm. So I'd be concerned about that. Mm. Now, in terms of precautions, we used to say a woods with a heavy undergrowth. But I can tell you that we have ticks now in towns, in your backyard, here in State College.
Harrisburg.
So that doesn't hold true anymore. So you have to be careful no matter where you are, quite frankly.
And so what does being careful mean?
Well, if you're going into one of those more conventional tick habitats we talk about in the woods, wear a repellent, although DEET does not work as well as we'd like. The better one is permethrin, and use it as a spray, and you have to spray your clothing the night before and allow it to dry. You wouldn't want to put this on your clothing.
Be careful if you have a cat, because permethrins are toxic for cats.
Good to know.
And this stuff will last for a long time as well. So if you put it on and you have your clothing, your hunting gear, and you hang it in the closet, leave it outside or away from a cat.
And of course, when you come in, put those clothes in the wash, and more important than in the wash, in the dryer for an hour or so to kill ticks that you might have brought home on your clothing. Is that the advice as well? Well,
they found that it's surprising. This tick is fairly fragile, believe it or not. Doesn't do well with drying out desiccation. You'd think a hot wash would kill it, but probably only 60% of them that way. And even a warm dryer only killed about that many. You really have to have it in a hot dryer for an hour. So if you come in and you have woolen items, I would suggest you put them in the dryer on high for a period of time. At least then you're not going to shrink your woolens.
Okay. All right. We go to Lewis, who is calling us from Elk County. What's your question or comment, please?
Yes, I'd like to know where a person could go within the state, the premier medical institutions, where one could go and get treatment. I mean, I hear all these scams going on and the overcharging and quackery and all this other stuff, and people just having a terrible time getting treatment. where does one go to get treated, and is there any natural products can help?
Dr. Ostrov.
So I think rheumatology or infectious disease at any of your big medical centers, Pittsburgh, Hershey, Geisinger, several in Philadelphia, any of those locations, those types of specialists, if you're having trouble getting sort of a definitive diagnosis and you're concerned or your blood work's positive but nobody wants to treat you or whatever the issue is. The treatment's antibiotic therapy for those first few months, and the earlier in the course of things that you get antibiotics, the better. So if you have rash or you have a recognized tick bite that the tick's been on you for a long time and you know you're in a high-risk environment, high-risk ticks, then the antibiotics work best if used early on. From the natural kinds of products that you're talking about, that would not get rid of, they don't have antibiotic properties, but they might help if you have aches and pains afterwards or fatigue afterwards until you completely recovered. So some people like vitamins, other people use the anti-inflammatory nutritional oils that have good properties like fish oil. They help with some of the joint pains. So there are a variety of things you could consider like that to help, but you really need antibiotics early
But the
on.
things you just mentioned aren't cures.
They are not cures. They're symptom treatment, right, just symptom relief. You really need the antibiotics early on in the course to eradicate the infection.
Okay. I've had ticks several times because I'm a pet owner, and I know what happened for me was I went to my doctor, I had a tick attached, and I didn't know how long, but I knew when I had been outdoors, and based on that and some other things, I was given a prophylactic dosage of doxycycline, which amounted to 2 pills, which I took together.
Right.
How important is that? And then, of course, I was not tested for Lyme disease because I shouldn't need to be.
Right. So, so Lyme disease testing, that's a separate discussion, but early on you'll have false negatives, and it takes several weeks for you in a fresh situation to mount a positive antibody test. The prophylactic antibiotics should only be used within the first 3 days after significant exposure, after at least 24 hours exposure.
We'll take a call. We've got a cough going here. Gail from Wellsville, what's your comment or question?
Hi. My question is, a caller touched on it earlier, several other tick-borne diseases that we are finding in support groups around the state are quite common. My family has 2 or more tick-borne disease co-infections, and a lot of the family doctors and pediatricians do not know to test for this besides Lyme. What can we do from the doctor's perspective to make them more knowledgeable at the common other tick-borne diseases and get tested right away?
And good question, and this is something I'll follow up with you, Dr. Lippman, because the same is true among dogs, pet owners, that doctors aren't aware of this co-infection possibility. Dr. Ostrov.
Yeah, I mean, I think that a lot of doctors are aware, excuse me, I'm sorry, I'm just getting over a cold, that in the scientific data, it's about 5% of people with Lyme have co-infection. Since the antibiotic treatment is basically the same, and some people may have positive antibodies that don't actually reflect true infection, that they have been exposed but not infected, and that's the same issue that you raised before with the pets as well. When you live in a very Lyme endemic area, you get exposed a lot, but a lot of people's immune systems just prevent you from being sick from it, and just like many other things. So you have evidence of exposure, but no signs or symptoms of actual infection.
But speaking to her other point, I have to say I was very grateful when the doctor gave me this prophylactic dose. But I've known other people who've had a tick attached and it's engorged, and they know it's engorged, and they know they've been in an area that was had a lot of infected ticks, and their doctor didn't do the same thing. Wait and see if you get any.
Right. Well, I think
or they weren't aware of Lyme disease, which is what she was saying.
Yeah, I think if you're in if you're in a highly endemic area that your ticks are known to be infected, and you come with an engorged tick, I think absolutely the single-day dose of doxycycline is appropriate, and I would definitely do that.
So if your doctor doesn't prescribe that, see another doctor, and are more and more doctors getting to know the standard protocol for this?
I think in our Pennsylvania area, as the epidemiology has changed, because the Lyme disease we were talking about earlier in the last 20 years has really migrated across the state. So I think more and more people are aware.
Okay, we have an email I'd like to get to, and then I'm going to get back to Dr. Lippman about Lyme disease. Do you have that email? This person, I was diagnosed with Lyme in 2012 and again in 2013. Both times I was treated with doxycycline. I have since developed arthritis, have very cold hands and feet, have numbness and tingling in my fingers and toes, and have chronic fatigue. Do any of these symptoms go away? Dr. Ostrov.
So I don't know how long the treatment was. If it was long enough, it should be at least a month. If someone has recurrent, definite Lyme and recurrent symptoms, whether or not a month of IV ceftriaxone.
1 month the first time and 2 weeks the second. Their treatment, their antibiotic therapy.
Okay, so I would treat a month, and then I would treat another month. And if it was a very rapid recurrence of symptoms, I would have gone right to ceftriaxone, the IV therapy, for the third round. I have found that to be the most curative in people who are resistant to the oral antibiotics.
And you're finding that among children who developed Lyme disease, you can cure 98% of them.
Yeah, so children are more responsive to treatment. They have many fewer chronic issues. They often present with arthritis, and so they don't present with cardiac or neurologic symptoms usually. And most of them get better after 1 or 2 months of oral antibiotics. Occasionally you have to go to the IV antibiotics, but the cure rate in children is extremely high.
Okay, let's talk about the other members of our family, our pets. Experts say that for veterinarians in areas that are known to be relatively free of infected ticks, Lyme disease is often overlooked. And on the flip side, where there is known to be Lyme endemic areas, the fear is that dogs are overdiagnosed and overtreated. Are you seeing that?
Well, I think what helps is that we have screening tests that we can do to know what our baseline incidence is or prevalence in our neighborhood. And so many veterinarians will do these screening tests that are for heartworm, for Lyme disease, for anaplasmosis, and for ehrlichiosis. So right away we know whether an animal is having antibodies to the tick-borne diseases in that panel. And if the dog is showing no signs at all, which is the most common, then we don't usually treat. But we do a screening test then on the urine to be sure there's no hidden protein in the urine that might be a warning that something might be going on that the dog isn't showing any signs yet. So I think in some ways we're ahead of what they're doing in people, because we would have picked up anaplasmosis, and the dog is actually a sentinel for what's going on in that neighborhood. What are the ticks carrying? And it's helpful for you to tell your physician what your dog is positive for, because that might help just to know what the environment has.
Lyme disease, there's a vaccine available for animals. There was actually one available for humans, but it was pulled from the market in 2002. When would you advise a vaccine for dogs or cats? I don't know that there is one for cats, but for dogs.
I actually don't use Lyme vaccines at University of Pennsylvania. Very many local veterinarians do use Lyme vaccines. But a lot of the specialists have questions and concerns about whether it's really necessary, because we need good tick control anyway, because we have anaplasmosis and babesiosis, ehrlichiosis, Rocky Mountain spotted fever, Bartonellosis. So we need to use good tick control in our area anyway. Another thing that there's a controversy about, but there's debate, and there's no proof that the vaccines would be harmful in this way, but theoretically, we worry that because the most severe form of Lyme disease in dogs is a kidney problem that is an immune-mediated disease, that maybe it's not a good idea to vaccinate to add potentially antigen and antibody complexes circulating in the blood that theoretically could be deposited in the kidneys. But I do want to say that most dogs that are exposed to Lyme disease become positive on the test, but show no signs of problems at all.
And there's similar data in humans. The first cases they tracked outside of nature preserves. They tracked all these people that became seropositive, positive blood tests, and only maybe 5% ever had any symptoms. So the same thing is true for humans.
Some argue that we should vaccinate our dogs because the dogs are bringing the ticks into us, and if they die on the dog, then they're reducing the risk for their human owners.
Well, the tick prevention will cause the death of the tick too.
Okay.
And it will also cause, prevent ticks from being able to pick up any organisms from the dog. So I would use good tick control because of all the other tick-borne agents that we have in our area anyway.
What constitutes good tick control? And we'll go to our next question.
I prefer to use the kinds of products that prevent tick attachment because, as I say, there are other tick-borne agents that could be transmitted faster than Lyme. So there are some products that don't kill the tick until it's been attached for a day or so. And that would be okay for Lyme disease prevention, but it may not be fast enough for the prevention of the other tick-borne diseases. So I remember for our Homer, when we were using a product that allowed the tick to kind of wander on him but not be able to attach, that we often found the tick right on the dog's forehead, kind of in a daze, because it would go towards the CO2 and also their anti-gravity, so they like to go up. So if you find ticks on your dog but they're not attached, that's good. The product is working. But they won't attach to people because their mouth parts have already been paralyzed.
Okay, good to know. If you're just joining us, I'm Patty Satalia, and this is Conversations Live Lyme Disease on WPSU TV and FM and WQLN in Erie. Let me reintroduce our guests. Steve Jacobs is an urban entomologist and senior extension associate at Penn State. Dr. Merrill Littman is a veterinarian and a professor of medicine at the University of Pennsylvania School of Veterinary Medicine. And Dr. Barbara Ostrov is a rheumatologist and professor of pediatrics and medicine at Penn State Hershey Children's Hospital and Penn State Hershey Medical Center. Our telephone number is 1-800-543-8242, and our panelists are ready for your call. And we'll go to Lisa, who is on the line right now from New Cumberland. Go ahead, please, Lisa.
Yes, hi. I'd like to make a statement and along with a question. I have two children, a daughter, 17, and a daughter who is 9. My 17-year-old daughter was debilitated by Lyme disease, and it took us over a year and a half going to some of the hospitals that you had mentioned that had told her basically she was crazy or she had an eating disorder. And I'd just like to state for those people out there who are suffering with Lyme disease, especially witnessing it in their children, that what their children are suffering is real, and that the parents do know their children, and if you feel they are sick, do not give up hope, because you tend to lose hope when you see doctors not willing to listen to symptoms or realizing that the doctors aren't.
Was she testing? Was your daughter testing negative for Lyme disease? Is that the reason she wasn't getting the treatment you thought she should get?
She was not getting. She was actually hospitalized for 5 days without running blood tests for Lyme disease, and we had requested that.
And so you do have a positive. You did end up with a positive diagnosis for Lyme?
We do. We ended up coming up with a positive diagnosis for Lyme with we ended up coming up with a positive diagnosis for Lyme disease by going outside of the box and not, what should I say, going just by the regular hospital testing. We went through a more extensive testing called IGeneX.
Do you know anything about it?
Yes.
Okay. Let our guests respond to that.
So IGeneX uses multiple non-standard Western blot bands that are not approved by the CDC, and they have lots of plus minus borderline positive results. They're done in California, and I've never seen a negative one. So I don't know how to interpret that.
Okay. And what was your question for us?
Well, actually, my question was about the testing. How are we allowed to have some tests that say they're negative, but some tests that say they're positive? As well as, that's a double-ended question, why are we only allowed to have so many panels, or panels I know is not the right word, and it's escaping me.
I think our doctor knows what you're getting at, so let's let her respond to that, and thank you for your call.
So I think that there are standardized tests that are approved by the FDA and recommended by the CDC. Those include the ELISA, or screening test, which is a total antibody level. And then usually after that, the Western blot, which is a very specific test and tells if it's early versus later infection, and recognizes the antibodies to the multiple different proteins on the surface of the Lyme bacteria. And there's 10 standard ones on the late test. And then there are some other tests, like a C6 peptide test and polymerase chain reaction, that are, not as commonly used.
Are you suspicious of the test she finally got?
Yeah, I never trust the IGeneX test. They're a lab in California that has about 20 different bands on the Western blot, and the reports, as I said, never have a negative.
I'm assuming that she feels better now from whatever treatment she received.
Well, I would hope so.
Okay.
I don't know. The problem, of course, the testing isn't always accurate. If someone's had a lot of antibiotics, can falsely lower the antibody level, so your blood tests come out borderline positive. I think what she was talking about, allowed to have testing, is probably her insurance paying for it, is what she's referring to. And so, if you do, from just a statistical perspective, if you do a test over and over and over and over again, you will ultimately have one out of those 20 checks to be positive as well. So.
Is there something that mimics Lyme disease in humans that maybe could have been, a lot of people who think they're suffering from Lyme disease may be suffering from something else?
Well, in children, I'll talk about, sort of something maybe relatively straightforward. Children who have juvenile idiopathic arthritis, which used to be called juvenile rheumatoid arthritis, commonly present with a big swollen knee, and that is the most common presentation of Lyme disease. So anytime I see a child with a swollen knee, I always have to think about Lyme versus juvenile idiopathic arthritis. People with Lyme can have heart rhythm problems. They can have neurologic problems. They can have what's like a viral meningitis picture, what's called aseptic meningitis. Lupus can look a lot like that, so you have to think about lupus in that situation. So there are a lot of things that can certainly overlap the symptoms. Once you're about a month out from the tick bite, the antibody production of the human immune system to the spirochete starts to go up pretty well, and so certainly by a month, or at most 2 months, you usually have positive blood tests, unless you have an immune system problem, or unless you've had a ton of antibiotics already, which partially treat that. So
okay, well, thank you. We go to Chris, who is calling us from Hastings. Go ahead, please, Chris.
I was just wondering, can Lyme disease cause otherwise inexplicable symptoms such as possibly a fracture, exhaustion, along with the better known symptoms? And also, how long would it take after the initial infection to see signs and symptoms of Lyme arthritis, and how would one know that it wasn't osteoarthritis?
Thank you.
So a fracture would not be from Lyme disease, so I can reassure you of that. So osteoarthritis is quite different than the arthritis of Lyme. So osteoarthritis, the symptoms usually come on gradually over a number of years. It's usually involved in multiple joints, and there's usually pretty clear X-ray or physical exam evidence of bone spurs and other changes of osteoarthritis. The arthritis of Lyme disease is an intermittent inflammatory arthritis when it settles into the joints. Early on, it can be just aches and pains, but as it settles into its inflammatory stage, it's usually a big swollen joint, and it's large joints, usually not small joints, and it really is very, very different than osteoarthritis.
All right, thank you for your call. Before we take this next one, because timing is so important in terms of whether the disease is transmitted to humans or to pets is so important, I wanted to ask you, Steve Jacobs, about proper removal of a tick.
That is important. If you find a tick early enough, you must remove it in a proper fashion. You don't want to grab this tick by the body and pull it out with your fingers.
And we have a picture that can help illustrate what you're talking about for those.
What you end up doing is squeezing that much like you would squeeze an eyedropper, and forcing spirochetes up through the tick's esophagus and infecting yourself, when in fact you may not have been at that point. So you want to grab the tick close to the skin with a pair of fine forceps or some other device and just pull it straight up with steady pressure. Sometimes the mouth parts, the hypostome, will stay in. Not a big issue. Just topical antibiotic is probably all you need in something like that.
Okay. And it's interesting, Dr. Lippman, because there are so many tools, gadgets available out there to remove ticks in your pet. I actually have one that you slide under the...
It's like a spoon with a V.
And you turn it. It has a V, exactly right. Is that an effective way to remove one from your pet?
Yeah, that's good too.
Okay.
Yeah, you don't want to crush the body of the tick in your bare hands because the juice of the tick could have agents in it, you know, that you don't want to get around your cuticles. So.
Well, a good reason.
Yeah.
Now, if someone were to bring you a tick that they've removed from themselves, it's been engorged, can you tell on testing whether this one is infected or not?
We don't do that here at Penn State. You can do that. There are some facilities that do that. And that may be valuable for certain people. I know it's an expensive test, typically. And historically, we suggest people don't do that, save their money, look for the symptoms, or talk to their physician rather than having the tick tested for spirochetes, because it may have spirochetes, but it may not have infected you by that time.
Of course, too, we know that not everyone gets symptoms. Right. Dr. Ostroff, and I'll take this next call in just a moment, but what percentage of people who have been bitten by an infected tick will and end up with Lyme disease present with the classic telltale bullseye rash?
So the bullseye rash, which is referred to as erythema migrans, is less than 50% of people for the most part. It's somewhere around, you know, sometimes 40%, sometimes 60%, depending on what studies you look at. But it's not itchy or painful for the most part. Occasionally there's rare cases where it is, but it's mostly a very pale pink circle that gets bigger and bigger. Yeah, so that would be a rash where the tick bite was probably in the middle of it. But about half of people get what are called secondary erythema migrans, which means that they get multiple other lesions, and in those they're just rings because that wasn't the tick bite in the middle. And so you can see this all over the internet if you look at pictures, but there are multiple rings and they're expanding. The biggest one I ever saw was one ring the size of an entire trunk of a teenager's chest.
And then there's almost no question that this person has been bitten by a
so that kid's mother was a nurse, and he had joint pain and came in and he laid down on the exam table, took his shirt off, and there was this huge erythema migrans, so the diagnosis was pretty easy. So.
And is he better today?
Yeah, he was completely well after 4 weeks of antibiotics. So.
Okay, good news. We have John from Whipple Dam on the air. Go ahead, please, with your question or comment.
Thank you for taking my call. I'm a senior resident in a cabin near Whipple Dam in the woods. I have been bitten and attached and embedded 3 or 4 times, 2012, and I'm currently treating one in my left arm due to a bite. Now, the way you show the stories of removal is my question. The most recent one, the one on my arm right now, is gone. And when I realized it hurts in the muscle of your upper arm, all that I could see in the bathroom with a light in a senior age was the 2 little feet sticking out.
And you didn't remove it yourself, or is that what you're telling us?
And of course, that was like on Sunday midnight, and yes, I wanted to remove it. So, number one, would you would you address that? How should you treat when they are fully embedded? And by the way, to you people, I have had them attached and embedded and engorged both kinds, the large ones and also the one I'm talking about, my left arm, is a little black one. There.
I would recommend the prophylactic treatment for this person, wouldn't you, Dr. Ostrov?
Yeah, sounds like. Unless he can't take it, you know. For
so what would you recommend, Steve Jacobs, for this person?
Well, the tick hasn't really embedded itself in the gentleman's skin to that depth. What has happened is, through irritation, the skin has swollen around the tick, and all that he can see now are the legs. I would advise someone in that situation to definitely go to the doctor as soon as they could.
And have them remove it.
Have them remove it.
Okay. And how important is it that you wash that area and disinfect that area where the bite took place, whether or not it's an infected tick or not?
I'm not a doctor, but I would say that's always good advice.
Dr. Ostrov?
Yeah, I mean, obviously, if his tissues are, I agree with you, swollen that much around it, he's going to need some antiseptics and things like that to help with that. So.
Okay. Soraya from Elizabethtown, I hope I'm pronouncing your name correctly. What's your question or comment, please?
Hi. Yeah, you're close, Soraya. Thank you for taking my call. I'm in Elizabethtown. I was just going to comment first, that woman whose daughter was in New Cumberland. I also had a lot of trouble getting a diagnosis here, and it took a long time. Thankfully, actually, my diagnosis was made at Penn State in the ER eventually, and then I was treated with IV ceftriaxone, and I've been off of that now for several months, but I've developed some chest pain and some irregular heartbeat, and also my blood pressure goes down at times, and then my heart rate goes up. And I did see a cardiologist, and she thought that, you know, maybe it was normal aging, and, you know, I'm only 51. I never had any of this before I had the Lyme disease, and I don't know, you know, what to do now, who to go to, or what kind of treatment is available.
Dr. Ostrov?
How long were you on the ceftriaxone?
It was actually on for 10 weeks.
10 weeks. So more than the, you know, pretty prolonged treatment, actually. So, you know, I certainly don't know about your rhythm issue, but I would pursue that because that's really important thing. That's, you know, one of the complications that, you know, could cause difficulty. It's only about 10% of all Lyme disease gets rhythm problems, but I would pursue that.
And with whom? What kind of a specialist should she see?
Either I would think about going to infectious disease or seek another cardiology opinion.
All right, thank you, and the best of luck to you. We go to Karen, who is calling from Petersburg. Go ahead, please, Karen.
Hello. I'm calling because my son had been diagnosed with Lyme disease back in 2009, and he was treated at that time. And since then, he does work out in the field. He's a biologist. He works in streams and near underbrush and so forth. So he's been bitten by ticks numerous times. And he had a severe virus in January and then never really fully recovered. And right now, he has symptoms in his chest and in his throat. And he's been checked by GI specialists, and he's been going to multiple doctors. They think there's a neuromuscular component to this. So my question is, and he's had the Western blot, and it comes back negative. There was some question whether he should be tested again. And so my question is, can Lyme cause neuromuscular problems, and have you heard of distress, like with dysphagia and chest discomfort from having like a long-term Lyme problem?
And could it be another disease that's transmitted by a tick?
Or leptospirosis or other wildlife kinds of things.
He's out, has lots and lots of exposures. Right. I mean, I think this gets to what we were talking about before. You don't want to just assume
that it's
Lyme when testing for Lyme is showing up negative, and there's lots and lots of other exposures that you'd have to really think about.
Not just ticks.
Yeah, I mean, I don't know what manifestations your son had when he had Lyme in 2009. If he was fully recovered, and had no neurologic issues at that time, it would be unlikely to have neurologic things 3 years later that would be related to that infection. I've not heard of throat problems. Dysphagia, it's a hard thing to say. That can be heartburn, that can be muscle problems. There's lots of possible explanations for that. But I would pursue other possible tick-borne or environmental-borne illnesses and not worry just about Lyme.
And the truth is there are tick-borne illnesses that are much more serious than Lyme disease.
I mean, in a high percentage, Rocky Mountain spotted fever is a good example. I mean, people don't talk about that so much anymore, but that's a life-threatening, acute, sudden onset, life-threatening illness.
And there's more Rocky Mountain here than in the Rocky Mountains.
Yeah. So.
Wow. We have a tweet that we'd like to have answered. Can you get that up for me? Is applying a pesticide to the lawn effective to contort ticks around?
Control.
To control. I'm sorry, ticks around the home. Steve Jacobs.
Yeah, most insecticides are very effective against ticks. I would caution people not to treat their lawns. These ticks, as I mentioned earlier, are fairly susceptible to desiccation. So if you keep your lawn cut, as long as your lawn doesn't flood frequently, and you don't have a lot of tree cover, so the lawn dries out, those ticks won't survive more than a few days out there. However, if you have a lot of canopy, and then you have ground cover, pachysandra, things like that, or spruce trees with a lot of beds of the needles down there that they can burrow into, then you might want to use an insecticide. In those situations, I would probably recommend one of the granular materials that would be watered in to get down into that lower layer where the ticks hide when it's during the daytime. Most of these ticks aren't active at the height of the day. They're more active in the early mornings or late in the evening. So those things are effective.
There are places in Centre County, for example, speaking of Scotia game lands, that are so infested with ticks. I recall about 5 years ago, my son and his class went on a field trip there, and literally every person on the bus had multiple ticks, some as many as 8 or 9. And I wonder, in situations like that, would a controlled burn help to control ticks?
That would take care of them. That would be the end of them. Yeah, a good fire would do that.
Do we need something like that? Because it sounds like ticks they're surviving winter, and we're seeing more and more of them. I would think if we're seeing more and more cases each year.
Scotia is sort of a peculiar place. It's the undergrowth is very thick. There's a lot of deer out there. There's a lot of rodents out there, squirrels. So you have sort of a perfect storm that occurs there. So that is a bad spot, but there are a lot of bad spots like that throughout Pennsylvania, and so you can't burn all those, you can't spray all of those, so you really have to use personal protection and just examine yourself when you get back and just be vigilant with that. Okay,
we go to Anna, who is calling us from Bradford. Go ahead, please, Anna.
Yes, I really enjoy your show, Mrs. Satalius. You're a great
thank you
moderator. And your guests are very informative as well. But I'm a nurse in a rural town, and it's difficult for physicians to know when there's a lot of controversy and so many limitations on insurance and what they'll cover, especially for Medicaid patients. What do you recommend? Do you recommend that a patient that is showing a lot of symptoms of Lyme, that has, say, 3 negative Lyme titers, do you recommend it, and is it cost prohibitive to test for each bacteria that a tick carries? Because are we talking about 6 or 7 bacteria that they actually carry?
Right. So the Lyme testing itself, I mean, most of the insurances cover testing. Even medical assistance actually covers it, covers testing fairly well, and a lot of the hospitals that do the testing can't charge the difference between what the insurance pays, and so the patient is not, forced to pay the difference. But each test, I mean, the Lyme disease testing is probably $150 to do the whole sort of sequence of testing. And I thought you were going to ask about the cost of antibiotic therapy. So, I mean, amoxicillin for the young patients is very inexpensive. Doxycycline is actually recently more expensive, used to be cheaper. But going to the IV is very expensive because that's getting a line placed and getting the IV and visiting nurse. So that's the one that really runs people not so much the testing, but the very prolonged antibiotic therapy that some practitioners recommend. That's what really costs people a tremendous amount of money. But I don't think the testing, and I think if the Lyme testing is negative 3 times, then I think you need to start thinking about one of the other, if they truly have had tick-borne illness, then one of the other infections. And not just worry that it's Lyme, because there's so many other things that could be going on.
All right, thank you for your call. Sue from State College, your question or comment?
I have a question for the physician and the veterinarian about antibodies. The Lyme produces antibodies, and they stay in the system.
Correct.
Can they become active and you have another onset of the Lyme disease?
Right. So the antibodies are produced by our immune system in response to the infection, just like our immune system responds with antibody production to any infection. The antibodies that we produce in response to the Borrelia infection is not as protective in preventing you from being reinfected, unfortunately, as it is for, say, chickenpox or other things. When we develop antibodies, we're very highly protected from getting that again. So people can get reinfected.
Without being bitten by another tick, they can relapse.
No, well, that's two separate things. So you can relapse, and the arthritis can relapse in the people who fail antibiotic treatment. No, I'm referring to reinfection, a brand new infection. And the way you know that is if you've had, say, arthritis, or you've had Bell's palsy, and then 6 months later you have erythema migrans. That's a brand new infection because it doesn't go backwards in sequence. So people can be reinfected. So the antibodies are not as protective as we would like, unfortunately.
Anything to add, Dr. Lippman?
We have a test, the C6 peptide antibody test, that will stay positive for years, even if you've treated the dog. And the better test, if you know that you're treating a dog, is to do a quantitative test. And that usually wanes in 6 months after treatment, and then we have a new baseline that we can use as a comparison in the future, because if the dog shows signs that make you think it might have Lyme disease in the future, and you do another C6 quant and you see that it's higher than that baseline 6 months after treatment, then you might say, well, maybe we need to retreat. But if it's the same low as the baseline, then we'll have to blame the signs on something else.
Well, we don't have that. We don't have that sort of combination of things in humans at this point. So,
and animals seem to respond better to the antibiotic therapy than humans.
Well, many times they don't need.
They don't even need it.
Right. Probably less than 5% of the positive dogs are showing signs of illness, and somebody did a study and said that 40% of the Lyme diagnoses are misdiagnosed, and really the signs are due to something else. So probably only 3% or less of the positive dogs get sick with arthritis, and even lower get the kidney problem.
Okay, we'll quickly go to an email question. As mentioned, there was an early start of Lyme vaccines for humans that was pulled due to increased risks. What is the status of a vaccine for humans? And actually, it wasn't pulled because it was, if I understood correctly, it was pulled because they didn't have enough people, people weren't mandated to take it, and there wasn't enough money in it.
Well, so that was part of it, but the other part was that there were reported side effects of people developing joint pains and a variety of other symptoms that were being attributed to the vaccine, and so it was a combination of those two things. I am unaware of anybody working on a new vaccine in humans.
Everything I've read indicates that no pharmaceutical companies are currently working on a new one.
But there's some neat ideas like the tick salivary protein kind of vaccines, and there's research going on, and maybe some new paradigm will come.
All right. We have just a couple of minutes remaining, and I'd just like to end, and I'm sorry I won't be able to take more of our phone calls, but I'd like to end with final thoughts. If each of you, from your perspectives as a physician, a veterinarian, and an entomologist, could get listeners and viewers tonight to do just one thing to protect themselves or their pets from Lyme disease, what would it be, or what final advice would you like them to heed?
So I think that really being aware of their environment, their risk in their environment, and getting ticks off early. Tick prevention, tick attachment prevention, and when you find a tick, get it off early, because if it's off in less than 24 hours, certainly, and probably in humans, even up to 45 hours or 48 hours, the risk of transmission is very, very low.
So you get home from a walk in the woods, take a shower within a couple of hours.
And make sure you do tick checks, and you do tick checks on your kids.
Dr. Lippman.
Use good tick control on your pets. Make sure you never use a dog product on a cat. And if your dog does test positive for Lyme, don't panic. It's a good sentinel for you to know what's in your environment, and check the dog's urine for protein.
All right.
And there's ticks all over Pennsylvania, increasingly to the west, and you can get them any month of the year. Probably August is your best month to be out. Fewer ticks transmitting Lyme disease.
Interesting. People assume that August is a terrible time, but good to know. Thank you all so much. Our guests tonight have been urban entomologist Steve Jacobs of Penn State, veterinarian Merrill Littman of the University of Pennsylvania School of Veterinary Medicine, and rheumatologist Dr. Barbara Ostrov, professor at Penn State Hershey. Our topic next month is forgiveness. I'm Patty Satalia. For all of us here at WPSU, thanks so much for joining us, and good night.